My name is Amanda Jelinek, and this is my full head-to-toe assessment. I'm going to start by scanning the room. Before entering my patient's room, I would check the chart. Once I do enter, I would provide privacy by closing the door or curtain. Then I would perform proper hand hygiene and introduce myself and identify the patient. And hello, Mr. Perez. My name's Amanda. I'm going to be your nurse today. Can you show me your wristband and tell me your name and date of birth?
Marco Perez, 7988.
All right, thank you so much. And what brings you in today?
Just a checkup.
All right, and are you in any pain?
No.
Okay. And can you tell me where we're at today?
At home.
All right, and who is the president?
Donald Trump.
All right, my patient is alert and oriented times 3. He has told me who he is, where he is at, and the time. Excuse me. Looking at my patient, he is well groomed, nice and clean. He is dressed appropriately for the situation. His facial expression is relaxed and appropriate. When he was talking to me, his words were clear and appropriate. His mood is calm. So far, he has shown me that his movements are intentional. He is nice and erect. There's no signs of kyphosis so far. And from me talking to him just a little bit, I can tell that his thought process is understandable and logical. And as we go on the assessment, I will continue to assess those throughout and make notes of any documentation if there are any abnormalities in that. All right. And now I'm going to go ahead and just jump to my musculoneuro so I don't forget that. So, do you have any problems with your joints, any swelling in your joints or aching?
No.
Okay. I'm going to go ahead and check your joints and just tell me if there's any tenderness. Let's start with your ankles. And your other one. And your wrist. And there is no swelling, no edema, any tenderness when I was touching?
No.
Oh, okay. I'm also going to have you lift your foot up and I'm going to do a Babinski test. All right, and there was no reaction, which is normal. Now I'm going to go ahead and have you stand up and I'm going to assess your gait. I'm just going to have you walk in front of the camera and back. Thank you. And my patient is, go ahead and stay right here. And my patient is showing that his gait is nice and steady. He was not swaying at all. I'm also going to have you take your heel and go down your shin. Thank you. And the other side. Thank you. All right, and you can go ahead and sit down now. Can you put your arms out and touch your toe, or I'm sorry, take your finger and touch your nose. And on the other side. All right, thank you. And do you have any history of any head trauma or any headaches or dizziness?
No.
All right. Now I'm going to go ahead. I would say that his Glasgow coma score is 15 because he's fully alert so far. I'm going to go ahead and do my cranial nerves and get them out of the way so I don't forget them. So cranial nerve number 1 is smell. Do you have a history of any smelling issues or tasting issues?
No.
Okay. If he did, I could test that by putting coffee or garlic under his nose with his eyes closed and have him guess what the scent was. And for cranial nerve number 2, do you wear glasses at all or have any vision problems?
No.
Oh, no dizziness or blurred vision?
No.
Okay. If he did, I could test his vision through using the Snellen chart. For cranial nerves number 3, 4, and 6, I'm going to test your 6 cardinal gazes and just follow my pen. Don't move your head. Alright, and that shows that those are all intact. For cranial nerve number 5, I'm going to have you open your mouth, check your TMJ, and there is no clicking, so that is good. And now I'm going to have you close your eyes and tell me if you feel a sharp or dull sensation and where on your face. And where at?
Forehead. Sharp. On my cheek. On my other cheek. Sharp on my chin.
Alright, and that shows that cranial nerve number 5 is intact. For cranial nerve number 7, I'm going to have you puff out your cheeks and raise your eyebrows. Smile without puffing out your cheeks. And frown. Alright, and that shows that cranial nerve number 7 is intact. For cranial nerve number 8, it is hearing. Do you have any history of loss of your hearing at all? Any loss of hearing?
No.
Okay. I'm going to go ahead and test your hearing. I'm going to whisper something in your ear and tell me what I said.
Corn. Broccoli.
Alright. I'm also going to have you stand up one more time and close your eyes. And just hold still. And alright. His Romberg test is positive. He's not swaying at all. Go ahead and sit down. I'm sorry, his Romberg test is negative, which is good. He's not swaying at all. So that shows that cranial nerve number 8 is intact. For cranial nerve number 9 and 10, I'm going to have you stick out your tongue and say ah. Alright. And his tongue is midline. And no deviation in the tongue. His soft palate did rise above midline, and that shows that cranial nerve number 9 and 10 are intact. For cranial nerve number 11, I'm going to have you raise your shoulders against me, alright, and push your face against my hand, and on the other side. Alright, and there's no signs of any weakness, which shows that cranial nerve number 11 is intact. For cranial nerve number 12, can you say light, tight, dynamite?
Light, tight dynamite.
Alright, and that shows that cranial nerve number 12 is intact. I'm just going to lower my camera a little bit so you can see a little bit better. Alright, so looking at my patient, his skin color is true to ethnicity. He has he has pink undertones. He is nice and warm and dry. There are no signs of cyanosis or jaundice. Do you have any history of acne or any rashes?
No.
Okay. His skin is nice and elastic. Shows he is well hydrated. His hair is appropriate for the color and texture for his ethnicity. It is evenly distributed. There's no signs of any balding. Do you have any history of hair falling out or anything like that? Okay. Now I'm going to go ahead and start my assessment from your head. Looking at his head, it is normal cephalic. His facial features are symmetrical. There's no signs of any wounds or abrasions or bulging, and I don't feel any either. Do you have any frequent headaches or any history of head trauma?
No.
Okay. Alright. And I'm going to go ahead and feel your temporal pulses. They are about a 2+ equal bilaterally. Now I'm going to go ahead and go to your neck. Looking at his neck, there are no scars or abrasions. He does have a tattoo on the one side. There's no bulging, no signs of any goiters or anything. Do you have a history or family history of thyroid issues?
No.
All right. Now I'm going to go ahead and test his lymph nodes. Then starting with, I'm going to turn just so they can see me, the pre-auricular and post-auricular behind the ear. And turn your head just a little bit more. Occipital behind the neck. And tonsillar. Moving under the cheeks a little bit towards the submandibular and under the chin for the submental. Now I'm gonna move to the side so you can see a little bit better. Okay, you turn just slightly, and I'm gonna check the posterior cervical and the superior cervical. And I'm gonna have you bend your head and check for the deep cervical. And same on the other way. Okay. And then straight and shrug. And the supraclavicular. I didn't feel any bulging or any hardness. I didn't feel the lymph nodes were not palpable at all. If they were, they would be soft and movable. Now I'm going to go ahead and look at the neck for jugular vein distension, which there is not any. I am going to move him to the couch real quick so he can lay down and do a 45-degree angle just to double check that. Alright, just hold yourself up a little bit. About a 45-degree angle. Alright, and there's no jugular vein distension at all. Alright, and you can go ahead and head to your chair. Now I'm going to feel for his carotid pulses. And they are about a 2+, equal bilaterally. Now I'm going to go ahead and listen to the carotid arteries, make sure there's no bruits. I'm going to use my bell side of my stethoscope, and I'm going to have you take a deep breath, and as you're letting it out, I want you to hold the expiration. Alright. Alright, go ahead. Turn your head a little bit so they can see a little better. And go ahead and take another breath and let it out. Right. And there were no signs of any bruise. Now I'm going to go ahead and have you take your shirt off if you don't mind. Do you have any history of upper respiratory infections?
No.
No. Okay. And any coughs at all? Or do you smoke at all?
No.
Okay. Looking at his skin on his chest, the color is still evenly distributed. He's still nice and warm and moist to the touch. I'm going to go ahead and start by percussing. And I'm going to start by the second intercostal space on the right. And go down, making sure to stay in between the ribs. And I'm going to do that on both sides. the sounds were resonant. Now I'm going to go ahead and listen to your breath sounds. Every time I touch you, I'm going to have you take a deep breath. And his breath sounds were clear on all lung fields. There were no signs of any crackles or rhonchi or any adventitious sounds. Next, I'm going to go ahead and listen to the heart sounds. I'm going to start with the aortic valve at the second intercostal space, right sternal border. And then I'm going to move to the left sternal border, second intercostal space. For the pulmonic valve, moving down once to the third intercostal space, to the Erb's point. And I'm going to move down to the fifth intercostal space, still left sternal border, for the tricuspid valve. And I'm going to move to the mid-clavicular line, still fifth intercostal space, for the mitral valve. And S1 and S2 were heard. The rhythm was normal. There were no signs of any murmurs or extra sounds. Do you have any history of heart failure or heart disease for you or your family?
No.
Okay. Next, I'm gonna go ahead and, as I'm looking at his chest, I also note that there are no signs of any lifts or heaves. Also, his facial expression is relaxed. He's not using any accessory muscles, showing that he is not in any respiratory distress. And now I'm going to go ahead and have you turn around so I can do your back, if you don't mind. Can you sit at all in there? Okay. How about we turn the chair? Go ahead and just sit facing that way so the camera can see it. Okay. Looking at his back, it is still true to ethnicity. There are no signs of any cuts or abrasions at all. No macules noted. He is still warm and dry to the touch. I'm going to go ahead and have you take a deep breath and let it out. And that shows that his expansion is symmetrical bilaterally. Also, if you were to look at just a little bit this side to the back, there is a 1-to-2 ratio for the AP diameter. Now I'm going to have you say 99 every time my hands touch you, okay, to check for your tactile firmness. And go ahead.
99.
All right, tight, and the vibrations did diminish as they were going down, which is a normal finding. There were also no signs of any crepitus. And now I'm going to go ahead and percuss the back lung fields as well, going from C7 to T10. I'm going to use the scapula at, C7, yes, C7 to T10. I'm going to use the scapula at, which is at T7, to go down 3 spaces to T10. And again, his sounds were resonant, which is a normal finding. Now I'm going to go ahead and listen to the back as well, to the lung fields. I take a deep breath every time I touch you. And again, his lung fields were clear on, lung cells were clear on all fields, equal bilaterally. There were no signs of any bronchi or crackles or any adventitious sounds. I'm going to go ahead and have you turn around before we move on to the abdominal area. I'm going to go ahead and finish up the face because I never did the eyes, ears, nose, and mouth. Go ahead and just take a seat. Alright. So looking at my patient's eyes, his eyelashes and eyebrows are evenly distributed. The hair is appropriate. His eyes are symmetrical. The sclera is nice and white, and the conjunctiva is pink and moist. His pupils are round and they are equal. They both did constrict to light, and I'm going to come to the side, and I can see that the opposite pupil is still restricting as well. That shows that they constrict consensually. Now I'm going to have you stare at the wall, and then when I bring my pen in, look at the pen. And that shows that his pupils did accommodate. His pupil size is about a 3 on both sides. And you already had told me you didn't have any history of any vision problems. There are no sign of opacities on either eye. Now I'm going to move on to the ear. And he did tell me he didn't have any history of any hearing loss. Have you had any trauma or damage to your eardrum at any point?
No.
No. Okay. I'm going to push on, turn your head, push on the tragus and pull on the pinna, and push on the mastoid process right behind here. And I'm going to do that on the other side as well. I'm going to push, pull, and push. And was there any tenderness in that?
No.
Okay. When I looked in the ear, there were no signs of any redness or drainage, no foreign objects. There was no cerumen. Now I'm going to move on. Also, excuse me, his top of his ear is in line with the canthus of the eye, which is appropriate, shows that they're symmetrical. Looking at his nose, it is midline. There is no deviation or perforations. It is nice and pink and moist inside. I'm going to have you hold one nostril in and breathe. And on the other side. Alright, that shows that his nares are patent bilaterally and his nostrils are symmetrical as well. Moving down to his lips, there are no lesions or abrasions, no wounds on them. They are pink and moist. If you want to go ahead and open your mouth a little bit. Looking inside, his gums are pink and moist. Teeth are intact. Can you open up again? There is no sign of any dental work. And go ahead and say ah one more time. His tongue was midline, the soft palate, and buccal mucosa, pharyngeal wall, they were all moist and pink. Do you have any history of dental work?
No.
No. Okay. And do you go to the dentist often?
Yes.
Okay. And open your mouth one more time. Look at your tonsils. And his tonsils are absent. Now I'm going to go ahead and move you onto the couch so I can do your abdominal. And I'm going to move the camera over just a little bit so you have a better angle. Alright, let's move a little bit closer. Alright, do you have any history of any change in your diet?
No.
No, any history of diseases or history of any diseases or surgeries?
No.
Do you have any frequency in your urine, urination, or burning?
No.
No. Do you know when the last bowel movement you had was?
No. Earlier
This morning? Is it pretty regular for you? And can you tell me what it looked like?
It was brown and soft.
Okay, good. And do you ever see any blood or mucus in your urine or stool? No? Okay. And do you have alright, I'm going to go ahead and start by listening to the vowel sounds. I am going to note that the umbilicus is midline. I'm going to start in the right lower quadrant. And move up to the right upper quadrant. Over to the left upper quadrant. Up to the left lower quadrant. And his vowel sounds were active in all four quadrants. While I'm listening, I'm going to go ahead and listen to the aortic, renal, and iliac arteries using the bell side of my stethoscope this time. Renal arteries and iliac. I could also check the femoral arteries, but I'm not going to do that today to not expose my patient. Now I'm going to go ahead and percuss. Okay. And the sounds were tympanic. There was a few dullness spots in the right upper quadrant, which is normal because the liver is there. And do you have no pain in your?
No.
And I don't feel any hernias or any bulging areas at all. Alright, and now I'm just going to have you sit up real quick and go over your arms and legs. And looking at my patient, you can see that his arms do have some tattoos, but they are symmetrical, as well as his legs. Both of them are warm and dry to the touch. I am going to have you go ahead and push against my hands and pull my hands and grasp my fingers. Okay. And I'm also going to have you do the same with your feet. If you can lift them up, push against. Alright. And then I'm going to have you take your feet and push against them and the opposite way. Alright, thank you. Shows that there are no signs of any weakness. While I have you right here, I am going to go ahead and check your pulses, the brachial pulse. And your radial. And those are all about a 2+, equal bilaterally. I am going to move down to the popliteal. These can be a little harder to find sometimes. And they're about a 1+, equal bilaterally. I am going to move down to the ankles and do the tibialis posterior and the dorsal pedis, and on the other leg as well. And they are about a 2+, equal bilaterally as well. Next, also I just want to note that throughout the assessment I have assessed his skin color and contour, and it is true to ethnicity all throughout his body. There is no wounds or abrasions anywhere, no signs of any macules. And after my assessment is over, I would go ahead and document all of my findings and